Registered nurses here in Singapore will soon be able to upskill and further develop their careers and prospects with a new Bachelor of Science Nursing program. It was created amid increased demand for qualified nurses and pressures on the system to meet the needs of an ageing population. The program is offered by private education provider Kaplan Singapore and UK institution Northumbria University. Nurses can work and study at the same time and complete the program within 24 months if attending part-time. They will get specialist knowledge as well as the skills needed for an evolving healthcare sector.
And for more, we're joined by K. Thanatlechymi, President of the NTUC Healthcare Services Employees Union, and Jamie Lim, Advanced Practice Nurse and Deputy Director of Nursing Service at Tan Tock Seng Hospital. Welcome, ladies. Jamie, let's start with you. From a hospital's point of view, have you seen a lot of demand for training like that of the new Bachelor of Science Nursing program?
Definitely, nurses are lifelong learner, so the demand for us to upskill is always going to be there. But I think the important thing is to have a program that is flexible so that nurses can well balance between work, family life and study. Yeah.
Thana, turning to you, the program is designed such that nurses, as we just heard, that it is flexible. Nurses can work and study at the same time. What kind of further support would nurses need so that they can balance their working and studying at the same time?
So I think...
Yes, indeed, nurses need a lot of support.
Thana, sorry, the question was to
nurses need
Thana.
A lot of support. Yes. Indeed, the nurses need a lot of support at work. Unions always promote flexible work arrangement as we have lots of dialogues and conversation engagement with the nurses. And one of the things that really, stands out is that nurses find that flexible working arrangement is something that they look forward to. We have instituted in the collective agreement a clause that a commitment by the institutions, the healthcare institutions, that they will, commit to flexible work arrangement for nurses so that they can well balance their work life, their upskilling by going for training, and also self-care, in a very balanced way.
Jamie, let's talk about some of the training that they will need, because Singapore has an ageing population and all of the attendant ailments that it often attracts, for some people at least. What kind of specialities would nurses and healthcare workers actually need to be trained in to handle what might be a flood of geriatric diseases and the issue of multimorbidity as well in patients?
Yeah, you're absolutely right. And actually, we have always been training specialized nurses, but I would like to refocus on the need to train community nursing. I'm sure Ms. Tana will wholeheartedly agree with me, really to upskill them to look after the aging population, as well as to equip them to look after patients with chronic diseases, not limited to the high blood pressure and the diabetic and the high hypertension. In fact, we have a whole long list of other chronic diseases. So really to upskill them to do disease prevention and health promotion. Really in line with the Healthier SG movement.
Thana, in line with what Jamie just said there, we do have this nursing crunch in Singapore, although there are moves to try and attract more to the sector. Besides all of these upskilling opportunities, what other kind of support can we perhaps put in place to further attract and, more importantly, retain that nursing talent?
Through unions' engagement with the nurses, we do find out that nurses have a challenging time in terms of their workload and lots of responsibility. And on top of that, of course, the wages is something that we can talk about. There's lots of recent revision that's been done, but certainly we need to ensure that the wages are competitive to the type of job and responsibility they carry. And in terms of welfare, we also need to take care of their mental wellness and well-being, and that it is important that we provide all the support that we can through proper counseling, third-party services, to allow for the counselling to happen in private. And these are things that the organisation can support the nurses with. Aside from that, when you talk about work prospect, younger nurses really want to build their career and they want to develop their career further. And that's why all these part-time programs like the one that Kaplan Northumbria that recently launched will certainly help to develop themselves in technology, cutting-edge technology, new knowledge. And digitalization and digitization is another way to ease their workload. But having said that, I think what is very important is that union together with the various employers in the public sector, as also MOA, we are trying to see whether we can elevate the status of the support staff so that to help, elevate the workload of the nurses. So if you upskill the support staff and our nurses actually can practice at the top of their license. So that is something that is work in progress. It's continuous work in progress. And we hope that if we were to steal the other workers as supporting the nurses, certainly nurses will be able to create more value to their job and greater satisfaction in discharging their duties. So this is something that we work alongside with all the employers. And
right.
also
thanks for that. Work in progress indeed. Thank you both. That was K. Thanalakshmi, President of the NTUC Healthcare Services Employees Union, and Jamie Lim, Deputy Director of Nursing Service at Tan Tock Seng Hospital.